Tell me very quickly, so how prevalent is the use of psychiatric medication in this country today?
The CDC's numbers say that it's one out of 4 adults, or maybe just under, is currently taking at least one psychiatric drug, and around 6 million kids. And you can define kids, that's going to be inclusive of teenagers, but it is certainly the trend that more and more kids that are younger and younger are being diagnosed and prescribed earlier and earlier.
And so, I mean, that seems like a huge amount. This would include some very simple medications all the way up to some, antipsychotics, or I'm trying to understand what kind of medications we're talking about here.
First of all, the idea of a simple medication is maybe mythological. There are medications that are familiar to us that have been very normalized. The only commonly prescribed psychiatric medication that I personally would consider to be simple would be a stimulant, like what's prescribed for ADHD. So your Adderall and your Ritalin. Those are pretty straightforward drugs. They've been around a pretty long time. They more or less do what it says on the box, what they're going to do. It's complicated enough that the scientific consensus will generally say we don't quite understand why these drugs work. And then, the definition of what do we mean when we say work there, that's certainly up for debate. But when it comes to antidepressants, anti-anxiety drugs, antipsychotics, mood stabilizers, sleep drugs, and that, there's increasingly a lot of off-label use as well. So if you are somebody who's taken an antidepressant for a very long period of time, increasingly people are prescribed antipsychotics despite not fitting any diagnostic criteria for which antipsychotics would typically be prescribed. But doctors will use these as an adjunct therapy when your antidepressant is no longer, you're not getting the therapeutic effect that you're looking for, generally because tolerance effects or whatever it is. Or you are presenting with what's called treatment-resistant depression, and so you're trying to find the right cocktail. All these terms that I'm using are pretty common parlance within the realm of mental health care, but every single one of them is a little package that once you start to unwrap it, it maybe flakes away. Like treatment-resistant depression, for example. I was somebody who was diagnosed at one point with treatment-resistant attention deficit disorder. And essentially what that means is that no drug treatment is sufficient. The severity of my disease is so great that I resist treatments that otherwise work for other people. And it's a very unique consumer product, right? Where if it doesn't work as promised, you blame the consumer. There's something uniquely improperly defective or unaligned with this treatment that works for other people. So that's sort of like part and parcel of the overall tendency of this psychiatric paradigm that underlies the entire mental health, industry, and everybody, whether you're a psychiatrist or not, the default orientation towards this stuff is this somewhat reductionist biological orientation to human struggle and human pain.
So, well, tell me your story. Tell me how you got into this.
So when I was in first grade, which would have been 1991, this is around the time that Ritalin was on the cover of Time magazine, and ADD was something everybody was talking about. And my first grade teacher in a parent-teacher conference told my parents, I think Cooper has ADD, and I think he would benefit from medication. This is a first grade teacher in like sort of provincial, rural, regional elementary school, who had probably read that Time magazine article and was also, presumably a pretty good teacher with some experience. So she made the case for my parents. And she also informed them that a decent number of the other boys in my class were already on Ritalin, and she was basically endorsing it. Today, people would be horrified that a teacher would take liberties to say such a thing and whatever, but at the time, my parents were horrified even then. And they were quite crunchy, and they were very thoughtful parents. I mean, my parents are wonderful, and they made the decision. They said, well, you know, it does sound like he does fit the criteria for this ADD thing, but we're absolutely not putting him on these drugs. And what I did grow up with was this sense that I probably have a thing called ADD, which is something about the way my brain is wired by default that makes it more difficult for me to perform in an academic setting, or follow through on certain tasks, or make myself do things that I don't want to do. My parents always said, when you're 18, you can make the decision for yourself if you want to go on these drugs or not. It ended up being age 17 when I made that decision alone with my primary care doctor, family doctor. I basically said, Doc, lots of people have told me I probably have ADD. I want to try the drugs. This doctor was a very sweet man, 80 years old at the time, still practicing. Called up a friend, probably another 80-year-old guy who was a psychiatrist. Hey, I got this kid in here. It says blah, blah, blah. What do you think? Yeah, okay, 10 milligrams. And that was the beginning of my career as a psychiatric patient. Started on Ritalin, 5 milligrams in the morning before school, and then a booster dose, although after lunchtime.
Did it help?
I went from a C student to an A student overnight. My entire life, every report card I ever got was does not work to potential, underperformed, distracted, class clown, all of this stuff, like the classic profile of a hyperactive kid. I was daydreaming a lot. Mm-hmm. There's an aversion to sitting down and doing a thing until it's done, unless it's a thing that I'm interested in. Mm-hmm. It's almost like a physical force field. Mm-hmm. Keeping me away. Mm-hmm. Sometimes I find myself like I'm forcing myself to like write an email that feels so tedious, and I realize I'm not breathing. It's that painful to be bored for me. What the drug did is it took that away, and it made basically anything I chose to focus on equally engaging. Everything felt like it was interesting to me. Mm-hmm. And so once I was able to direct that, I took great pleasure in directing it at the things I was supposed to do and that were necessary in order to achieve academically. And like within an institutional setting, I went from feeling like a liability and a problem to feeling like an example that a teacher could say, be like him. Feeling that for the first time in high school was a revelation for me. It was a thrilling experience, and it confirmed the idea that whatever's going on here is a chemical issue in my brain. Because if it can be corrected so demonstrably, how could it be anything else? You know, and why would I even be curious to find out if there's more to it? Right? The problem is solved. Like I can finally be who I'm supposed to be. The world can finally see me for what I really have to offer. And this was not a high dose. But even in the beginning, there were other things that changed. And I'll describe one thing. So when I was prescribed, and I think a lot of people have this experience, you know, the doctor is required to tell you, you know, you might have dry mouth, you might have difficulty sleeping, you might have appetite decrease or whatever. They're required to give you, there's informed consent is required. So they basically tell you, you know, the top line side effects of whatever the drug is. But what he couldn't have told me, because there's no studies for this, but what I would have known very quickly if I had talked to somebody else who had taken the same drug at this time in their life, who was of a similar type of person to myself, the drug does what it's, you know, it's really active for the first 2-3 hours after you take it. You have that morning dose, and you have like a lunchtime dose. But by 3, 4 o'clock, 5 o'clock, in high school and in college, you're done with class. You're done with school for the day, and now you're going to go socialize with your friends. At that time of day, the drug is now wearing off, and I'm experiencing what is widely known a crash. There's a stimulant crash once it wears off. And it looks a little bit like an inversion in some ways of the effect of the drug. So you're feeling a little less gregarious, or you're feeling a little more withdrawn, you're grumpy, you're a little more anxious maybe. And so that was the person that was showing up in all these social environments for me, right? Which cumulatively had an effect on who my friends were throughout high school, into college, and then who your friends are matters a great deal for how your life ends up unfolding. The way that that played out for me would never have played out that way if I had never gone on the drug. There's no reason the doctor would even think to talk about that at all. Like there's not a lot of like quantifiables in there to build studies around, to capture evidence, or define this as a risk of any kind. And so I think I offered that very particular example because this is all these different drugs. They have effects, and then they have indirect effects. Side effects is a marketing term. All effects are primary effects. There's a desired effect, and then there's everything else, which is generally understood to be a side effect. You're trying, when you're prescribing or when you're taking the drug, you're trying to get that desired effect and then minimize those undesired effects as much as possible. But some of those undesired effects, you don't even know what they are until you are quite a few years down the road. I think that is something that when we are talking about what needs to change on this whole issue, a big part of it is how do we expand the knowledge base from which we are making decisions about whether to go on these drugs or stay on these drugs or how many to be on? How do we expand that knowledge base beyond what is sort of the received expertise, the clinical, academic, the training of the clinician, the prescriber? How do we expand the awareness of the average person to seek out the expertise of people who have actually lived this for themselves?